It is so important to have international collaboration for multitudes of reasons, but really because it brings a different perspective, different patient perspective, different data, different ideas, and people come to a conference like this and they're in presentations all day, which is fantastic, but then they also get to have some informal conversations. And oftentimes that's where incredible partnerships are born and can lead to potentially to breakthroughs.
When we have written these perspective documents, opinions from Australia to polls and everything in between, so it's a very exciting joining together of ideas.
This is where it's at. Coming here and being with all these people, this is how we're going to cure ovarian cancer. We don't care where a cure comes from. This is the key.
Global collaboration is invaluable. We're seeing this in other diseases. Coalitions coming together, drawing knowledge and accelerating outcomes. That's what's brought us together.
People who are here are people whose work we've recognized for a long time, and so having these interactions has sparked new possibilities for collaboration.
I think international collaboration is key if we're going to make significant progress. Different skill sets, different ways of thinking about problems. It allows us to accelerate the pace of ovarian cancer research. If you have collaborators working in different parts of the world, it allows us to reach a more diverse population of patients. Because ovarian cancer in one group may be different from ovarian cancer in another group, we can learn how best potentially to treat patients in different parts of the world.
What international collaborations provide is an opportunity for people with different skill sets to come together. A really good example of that has been a global study on exceptional responders. No one lab has enough of them to really understand what's going on. So by bringing together different labs, we've achieved that scale. These things, perhaps acting in concert, can be really important in driving survivals.
I always get so inspired when I'm in a room with them, but then coming here in the international experience, that room is going to make a difference for women, and it's just really inspiring to be a part of that.
There's many memorable serendipitous sort of moment during these particular meetings. For instance, we come to realize that we both study the same pathway in ovarian cancer. This really created an opportunity for us to synergize and collaborate.
There have been fascinating advances in some cancers that have similarities to ovarian cancer. I think that's been a big part of this meeting. We are at an exciting time in cancer research and treatment, and we need to ride that wave for ovarian cancer.
International cooperation is so key, especially in this era of big data and AI, and that's how we're going to move the science forward faster.
I really would like to see that step change to go faster and further. It's just not going to happen without collaboration. Women being diagnosed today, they're going to have treatment options for them in a few years' time.
I hope patients and their families feel encouraged by so many people improving outcomes for people with ovarian cancer. Seeing an international group come together will make everyone feel like there's a real prioritization of these challenges, and hope that there will be new changes coming and new treatment opportunities soon.